that men were talking about how they wanted to feel desire too, that they didn't want to always be the chaser, the pursuer, the one doing the desire, that they wanted to feel wanted.
You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your private, helping you get in the know, down the low.
Hi everyone, welcome to another In Your Pants podcast. This is Dr. Susie G. Thank you so much for being here with me today. On today's show, we are going to be unpacking the myths and misconceptions around men, sex, and relationships. And to help me do this, I have a very special guest with me today. Her name is Dr. Sarah Hunter Murray. Dr. Murray is a registered marriage and family therapist. She obtained her PhD in human sexuality from the University of Guelph. Sarah is a regularly sought after sex and relationship expert and has been featured in numerous media outlets, which include Slate, Men's Health Magazine, Huffington Post, and Cosmopolitan. She authors the very popular Psychology Today blog called Myths of Desire, and she's also the author of the book, Not Always in the Mood, The New Science of Men, Sex, and Relationships. On today's show, Dr. Murray and I unpack the social, in air quotes, norms and traditional views around what it means to be a man and how that influences a person's sexuality. We also unpack the stereotypes around men and pornography. We talk about men's experience of desirability. And we also dive into mainstream culture that often depicts women as wanting to be seduced, romanticized, and cared for. But in Dr. Murray's book, she challenges us not to ignore this same concept in men. And lastly, we dive into feelings of rejection, especially around sexual rejection and how this impacts men's sexuality, self-esteem, and relationship dynamics. I hope that you enjoyed the show. Thank you so much for watching. And without further ado, let's dive right in. Hi, Sarah. Thank you so much for being on the show today.
Hi, Susie. Thanks so much for having me. I'm happy to be here.
Yes, and I'm so excited to talk about your work and the research that you've done, especially your book, Not Always in the Mood, about the new science of men, sex, and relationships. And I have a lot of questions to pick your brain about. So let's get started with just telling us about that conversation that you had that changed the way you think about men and sex.
Yeah. So what I often start by telling people is, I'm a woman and I'm a cisgender woman, and I have always been super curious about women's sexual desire. I started my research career understanding the complexities of women's sexual desire, when we're in the mood, when we're not, why our desire would decrease over the course of a relationship, why some women are able to kind of keep that spark alive. And as I went through my research, I started to kind of notice that while we talked a lot about the complexities of women's sexual desire, we never talked about men's sexual desire. There was this assumption that men's desire is high, constant, unwavering, simple, that there was really nothing to research because men are always in the mood to have sex. Mm-hmm. But then one day I was talking with my office mate, and she was talking about how her husband says that classic line, like, anytime you're interested, so am I, like, I'm always down to have sex. And she said that he said this kind of in like a dinner party setting, there was kind of like a bit of an audience, but she said to me privately, she's like, but that's not true. Like, just the other night, I asked if he wanted to have sex or initiated, and he said he was too tired. So like, what's going on there? And that was just kind of that turning point for me where I was like, yes, I think we all are familiar with that line, like, oh yeah, I'm always down. And those of us who are in relationships with men know that there's a lot of times where that's not the case. And maybe some of us experience it a little more frequently and some less frequently. But the idea that men are always in the mood to have sex just started to feel a little like painting with too broad of a stroke. So I was like, I need to talk to men and figure out what's really going on here.
Wow, that's awesome, because this research isn't really being done, and it seems like you're the pioneer in this research of kind of answering or asking those questions, and then gathering the data from men in your office, from clinical research. And I also wanted to kind of shift gears into the social norms. So talking to us about what those social norms and traditional views are around what it means to be a man, in air quotes here, and how
Yeah.
that influences a man's sexuality based on your research and clinical observations.
Yeah, there really is this social idea of how men's sexual desire is supposed to look. So we see kind of from like evolutionary theory, and I always talk about evolutionary theory in very simple terms. I know it's much more complex, but the idea essentially that, that men have been kind of wired to spread their seed, that it's advantageous to them to be ready to procreate as soon as a female approaches them and is interested. And so we have this idea that men are just biologically wired to have high sex drives. Socially, separate from what we might kind of have internally, we also see these messages that men receive that are very different than what women receive. And I'm going to particularly talk about the dynamics, in primarily like heterosexual relationships here. But women often receive messages that they are supposed to be the gatekeepers of sex. Good girls don't have sex. They wait until you're in love and someone respects you. Men, on the other hand, as young as like younger boys, teenagers are, not necessarily discouraged from masturbating. It's okay to have a sexuality. It's okay to explore your bodies. Again, very different than what young women typically receive from parents and caregivers. And as we get into our teenage years, a lot of men, in high school are rewarded socially for having partners, being like losing their virginity, being sexually promiscuous. And that tends to kind of continue. So there's this idea that masculine men, this masculinity theory, men want sex. They always have erections. They're always, down like DTF. So I don't know what's appropriate to say on your podcast.
Go anything and everything.
Okay.
Sarah, go for it. Down to fuck. Yes.
Yeah. Okay. So there's permission for that though, that like, that is how men are supposed to be. It's how men are either wired, how they're supposed to be to fit into social norms, and how they're supposed to behave in order to be perceived as masculine or even hyper masculine.
And in your experience and in interviewing a lot of men for your research, how does that influence their sexuality or relationships and even desire, or what happens when, there is some ejaculatory control issue or inhibition issue or difficulty? I mean, how do those social constructs really shape one's experience with their own bodies and in partnership or coupleship?
Yeah. So, I mean, anytime that I've like either interviewed men for my research or when I work with, clients in therapy, if men experience either low desire, and sometimes that's lower than what they've experienced before, right? Sometimes that just might be that they're 30, 40, 50, 60, and their desire is not what it was when they were a teenager or early 20s. Again, very natural, normal progression, but there's that comparison to that earlier stage of their life. Or they have lower desire than their partner, or they're just not feeling as much themselves, or they're having difficulties with erections and a lot of other issues. The first thing that typically happens is they say, I don't feel as much of a man as I used to, right? Like that idea of like sexual desire, sexual functioning being like inherently part of being a man. And any challenges to that, any changes seems to call that into question. So I've heard a lot of men kind of be really hard on themselves, judging their, manhood, I suppose you could say. They're worried they don't meet like expectations of what's expected for them socially. They don't meet their own expectations of how they've internalized what a man is supposed to be. And again, in the dynamics of, like heterosexual partnered people, I've also heard a lot of men say they worry about what like a woman would think, like, what is my girlfriend or wife going to think? Is she going to judge me? Is she going to see me as less of a man? And it's kind of hitting on all of those levels, but I hear that refrain very frequently in both my research and my clinical practice.
Okay. And that, as you're saying, it impacts not just what's happening in the bedroom, but also permeates through one's whole life and identity and relationship with oneself, self-esteem, dating, and all those thoughts are kind of percolating, and what that does with, all of our being, really. And that can be really distressing. And it also sounds like it's a lot of pressure for one person to, have, if these are these perfectionistic, these standards, these expectations that we are fed, technically, or these, internalized messages. and when we're not meeting up to those expectations or standards, again, how that plays into one's self-esteem, relationships, turning towards each other, in difficult times, as far as an intimate, sexy team, how that all kind of, plays into one's, identity and sexual health. Sexual health is part of health. But as you're saying, penis performance, historically has been kind of tied to, air quotes here, masculinity, right?
Yeah. And what was really interesting for me in my research is that, men that I talked to were very aware of these masculine norms, right? And they could be somewhat critical of them. They could say that doesn't seem fair, or that doesn't apply to me, or that sounds like just locker room talk. But also they had difficulties when they didn't fit into it, right? So it was kind of like, I feel like there's some movement here where we can be a little bit more critical and say, like, do we have to all fit into this tiny little box of expectations? And is it fair? And what about acknowledging this variation? Um, but some of the men I talked to actually talked about feigning sexual desire in order to try to meet expectations, that sometimes they would initiate sex that they weren't particularly excited to have because that was what was expected of them, particularly again with like a girlfriend or a wife, like when the partner was a woman. That sometimes they would just say yes to sex that they didn't really feel like having, because the idea was men aren't supposed to say no. I'm supposed to be in the mood, especially if she's interested. And so there was a lot of really complicated ways that men were navigating their own true experiences and wondering how authentic they could be in that expression of their sexual desire and like sexual activity, given that there are these expectations that they were just so aware of, and difficulties that showed up when they kind of broke from the mold.
And it also sounds like just vulnerability, having a safe space or trust to lean into that vulnerable space, which, historically, again, from the traditional view of masculinity or being a man, right, being vulnerable in that sense is like, well, that's a weakness, right?
Yeah.
Or I shouldn't be sharing my emotions, or I shouldn't be feeling that. And so I think it's the bigger conversation of, being vulnerable with your emotion, with yourself, in partnership as a human being is part of a human experience. And yet, you have social cultural and mainstream messages that are said, no, you shouldn't. That makes it very challenging, to be able to express one's needs, desires, communication, which actually enhances, and you can speak to this about enhances one's sexual experience or sexual intimacy and beyond, I could imagine.
Absolutely. And I see that a lot as this kind of, for men, this go it alone. Like they're not even sharing a lot of times with their partners, sometimes taking Viagra and not telling their partners that they've been struggling, not telling them that they haven't been as excited about sex, not like feeling like able to kind of communicate it. And what I find particularly in the clinical setting is that when men are a little bit more open about that, when they feel comfortable sharing, when they take that risk to be a bit more vulnerable, it's so helpful for a partner to be able to understand like everything that we're experiencing. This idea of pressure, like I need to be in the mood and my penis needs to respond the second that my mind is in the mood, or vice versa, like just that I need to be on. Going it alone, I mean, I just think adds to that pressure, right? It turns into a performance that I need to get ready to have this partnered activity, instead of acknowledging that we both, and in some cases more than two partners, but like for this case, that both of us play a role in setting a stage that's comfortable and sexy and arousing for both of us. And if someone's kind of hiding or like not disclosing a lot of the fears and pressures that they're experiencing, I mean, it's just another wall or a barrier to true intimacy.
Right. And that brings me into this next question, as far as, in mainstream, it's often depicted that women, love being seduced and romanced and cared for. And yet, in your book, you challenge that, actually. You challenge us not to ignore this for men as well. Could you please expand on this for us?
Yeah, I'd be happy to. And it's one of my favorite findings actually in the research. So I'll start by talking about the traditional norms we have, again, particularly when men and women are in relationships with each other. Men are encouraged to be the ones to initiate sexual activity, to kind of push to the next level of of sexual activity, they're the ones that kind of, do the desiring. They make women feel wanted. On a date, they'll show up with flowers. I mean, we still have kind of like norms about men giving women like beautiful rings for their, engagements. Like they're the ones who kind of make women feel really special. You look so beautiful. I love that color on you. Is that a new dress? Like these are the comments that we're used to hearing. And what I thought was really interesting, and not something that I asked about directly, but just kind of showed up spontaneously in my first set of interviews, is that men were talking about how they wanted to feel desired too, that they didn't want to always be the chaser, the pursuer, the one doing the desiring, that they wanted to feel wanted in return. And these things are funny for me to talk about, like the more time that's passed and the more time I've done the research, because I'm like, oh my gosh, of course. But still, it's amazing to me how often that's new information for people. I hear a lot of men say like, yes, that's what I've been trying to say. Like, I want to feel wanted too. I want to feel desired too. And having that language has been helpful for them. And women in a lot of cases haven't really considered, am I doing things to make him feel desired? Like, do I tell him that he's cute? Do I tell him that I think his butt's like sexy? Do I, go up and touch him out of the blue in kind of a flirtatious or even romantic way? Do I tell him like that I'm interested in sex? Do I kind of initiate it? And there's a lot of women that I talk to who kind of, do an honest like reflection and say, not a lot. I mean, there's obviously exceptions to every rule. But there's a lot of women I talk to who kind of think like, yeah, I don't know if I really considered that. I don't know if I really do those things. And I'll just be clear, there's a lot of good reasons that women don't always do those things, is because, again, these social norms teach us not to. We're taught to wait for men to come to us. So the idea of breaking that mold can actually be really challenging for some women. I've never considered how to assert my sexuality. I've never considered, do we have sex when I'm in the mood? Like I'm used to being like, okay, he said he is, and do I feel like it or not? So this can be really challenging if we've grown up with kind of really dominant social norms. And again, I think some of us have broke free from them earlier. Sometimes we break free from them more easily. But I work with a lot of people who these are very deeply ingrained social and sexual scripts that takes a lot of time to kind of relearn. But men, again, in my study talked about the importance of feeling desired. And so it's not just that they wanted a female partner or their wife or girlfriend to initiate sex. I mean, that's big and exciting and important. But again, it could be just receiving compliments. It could be like a brushing of my shoulder, like when she walks by, squeezing my butt or like rubbing my back. Like, honestly, it was so many beautiful kind of romantic examples of how men felt desired that wasn't just over the top overt sex. And I just thought that was so important to kind of acknowledge. And I love getting a chance to speak about it because I think it really changes dynamics in relationships to kind of consider like some of the softer, more responsive parts of men's desire and their sexuality than we typically talk about.
Yeah, and it's closing that desirability gap, right? Like, between this dualistic, gender role, again, in a traditional sense of what does that look like for me, for you, and oh, what if we happen to cross? Right? And when we both desire the same things, to be loved, to be cared for, to feel sexy, to feel wanted. And another beautiful segue, not planned for sure, but into rejection. You mentioned this in your book as well, and no one likes to feel rejected. Everyone wants to feel loved, cared for, and sexy, as you're saying, desirable, wanted. So how does sexual rejection impact men's sexuality? I guess let's talk about what the traditional views or social sexual scripts around rejection are, and really what the research is saying.
Yeah. So again, with this idea that men are the ones who do the initiating, there's kind of this assumption that like you must be expecting to get shot down. Like you must be just putting yourself out there all the time because you're just horny all the time and you're just kind of like, throwing and seeing what sticks or whatever that expression is. And like you're that there's going to be some no's in there. So that's kind of the expectation. It can't hurt that much because of course you're going to get some no's. What I found from the research is that initiating sex is actually a very vulnerable experience for men. And I think that happens at all times, but I particularly notice in a clinical setting that can kind of get increasingly vulnerable over the course of a longer term relationship, which I think is a bit counterintuitive to people. Like the more comfortable you get with a partner, the more that, you should feel safe and close. And while that's true, the safer and closer we feel to someone, the deeper their, rejection can hurt, right? So men were talking about how initiating sex is vulnerable because it's not just about getting off. It's not just a physical experience. It's not something that they're just kind of approaching like with this, willy-nilly, like it's meaningful. Like it's a way to connect. It's a way to experience closeness and connection and intimacy. And so when they're putting themselves out there, men in my research were talking about how much it hurt when their partner wasn't in the mood. And what I really like to be clear about here is there's always going to be times where one person's in the mood and the other person's not. And it's always okay to say no to sex that you don't want. However, it's kind of the way that we say no that I think has an impact, right? If we're kind of dismissive, like, oh, you just want to get laid, it has nothing to do with me. We can be kind of like, dismissive, eye roll, like, get out of here, ugh, whatever, roll over. It can be kind of in that mean, harsh category. What I think it's important to kind of acknowledge is, what are men really looking for when they're initiating sex? Is it okay to feel horny and just want to, have some physical pleasure? Like, yes, sex should feel good ideally, but are we ignoring that it's a lot more complex than that? And in some cases, a lot more complex than that, all those emotional things that men might be looking for. And so if we aren't in the mood, perfectly acceptable, but can we acknowledge that there's a bid for connection there? He wants to feel closer to me. How am I responding to that? If I'm not in the mood for sex, I can say, you know what, not tonight, but maybe do you want to cuddle? It's been a really long day. I'm just not there. Maybe we could have like a talk instead and we could try again tomorrow. Maybe I'll initiate next time. Like, it's just not there for me today. But kind of just being a little bit more gentle with that interaction. And I think there's a lot of damage that can happen when we're not aware of that. So it's kind of like this two-part collaboration for how to kind of, make some changes here. I often, when I'm working with men in therapy, I encourage them to kind of express, like, what are you getting from sexual activity? Like, what motivates you? I mean, you have to be honest about it. If you are taking the approach, like, I'm just wanting to get off and you're the only socially acceptable person to have sex with, then yeah, she's probably going to be dismissive if she's not in the mood, because that doesn't feel so nice. Mm-hmm. But if you want to feel close, if you want that connection, if you just want to touch and have a sexual or intimate moment, and you get so many more things from sex, which, again, from my experience, most men would say there's a lot of things that fall in that category for them. You need to be able to express that so she understands, because, again, we're all raised in this society that minimizes and simplifies men's sexuality. We all need a reminder of what's truly going on here.
Right. And it sounds like that's especially important when there's chronic illness or sexual pain. I work with men who have sexual pain, mm-hmm. and it is often very difficult to, one, be able to express one's needs and communicate, mm-hmm. like, this might feel better, or like you're saying, just not tonight. I'm feeling really bogged down with the physical pain I'm experiencing, the emotional pain I might be having. And so it's really important. I think what you're saying here is to give permission for folks to communicate with one another as far as, where they're at in that moment. And it doesn't mean that they dislike each other or that one person is responsible for the other's pleasure, right? It's more of just taking ownership and naming that, hey, today is just one of those lousy days. And like you're saying, what if we did something else? Or how can we connect in other ways that still might be pleasurable and satisfying and erotic, and yet still respect that protective buffer of whether that's anxiety or pain or otherwise, really.
Mm-hmm. Yeah, all really good points.
Yeah. Now, this might be a sharp segue, but I have a question, because you mentioned pornography in your book as well. Mm-hmm. And it's a hot topic, and I know it's very controversial and we know this, but I was curious, just kind of sticking with like your research around it, particularly around, again, the cultural stigma that, or not stigma, but the mainstream cultural view that men are obsessed with porn. It seems like what you gathered from your research that this isn't the case, and your clinical observations steer you otherwise. So can you tell us more about, how do men feel about porn, and what are the most common reasons men choose to watch porn over having sex?
And you're right. There's people who study porn and know, a lot more than what I'm about to share, but I'm just going to speak to like my research and what kind of came up in my experience and my clinical, my research and clinical experience. The thing that kind of struck me is that as I was interviewing men, we started to get to this point when I was kind of looking at my results with my committee at the time when I was doing my dissertation. And we just noticed we're like, nobody's talking about porn. Like I'm asking men about their sex lives, I'm asking about sexual desire, I'm talking about their relationships, and like nothing is spontaneously coming up about watching porn. I also know, as most people do, that like most men report watching porn. So I was
Mm-hmm.
trying to figure out like how do these things kind of intertwine. And so at one point, my advisor said, like, well, maybe you should ask more directly, like be like, do you watch porn, or like it hasn't come up yet, and just kind of like probe about it a little bit more just to see where it falls in. So I guess my first reaction was like, it was so interesting to me that it was almost like this like non-finding. I was like, I'm asking you about your sexuality, your sexual desires, like what that looks like, and porn's just not part of the picture. So I thought that was like an interesting thing right off the hop. When I did ask men about watching porn, they kind of acknowledged like, yes, I watch, and again, obviously there's some differences. Some people say a lot, some people say a little bit here and there. But the way they talked about their relationship with porn was a little bit different than I might have anticipated. Kind of downplaying how important it was. It's kind of like this side thing. Like I do it sometimes when my partner's out of town or when it's been a long time between sex. Um, but yeah, I think there's like, again, this idea that men are, again, sex crazed. So like, of course, they're watching porn all the time. They want the kind of sex that they're watching on porn. They want it to look that way. They want it to be that way. But I mean, at the end of the day, porn is always entertainment, right? It doesn't, I mean, there's some porn that aims to be a little bit more natural and authentic, but for the most part, this is like, you know, a romance, Hollywood movie. Like sex doesn't look like that. Romance doesn't look like that. Dates don't look like that, but what we're drawn to it because it's like fun and entertaining. When men were talking about porn, they talked about it like, one of the quotes that always stands out to me is like, it's either like going on your own vacation or watching someone else's pictures of their vacation. Like I would way rather go on my own vacation. I would way rather have sexual activity with my partner. But it doesn't always work that way. There's times where one of us is in the mood and the other's not. There's times where maybe there's some conflict. And even if we're both feeling horny, we just don't feel like we can overcome that emotional barrier at that time to connect sexually intimately that way. Um, and also, like when there are more problems, if men experience anxiety around their performance, if there's kind of some pressure that's starting to show up during sex, men also talked about how porn was a way to have kind of lower stakes sexual experiences. The pressure was less. They didn't have to worry as much. Like if I don't get an erection, like maybe I have feelings about it, but I don't also have to manage what my partner thinks about it. We're not having penetrative sex, so it doesn't like maybe lead to her feeling let down, and like that can happen depending on how couples navigate that. It just kind of lets all those things just go off to the side and just lets them kind of reduce that anxiety and pressure. And then they can kind of just get off on their own without having to worry about as much. So it's interesting to me because again, when I work with like couples, especially, I mean, I think identifying like, what is your true level of sexual desire? Like, when is it showing up? And, when it's like, oh, we haven't had sex in a while, and asking about masturbation and watching pornography, if that's happening on the side and there's not partnered sexual activity, I'm like right in there asking, so what's going on there and what makes you lean towards that? And, if we could reduce your anxiety and some of this pressure, would you maybe kind of be more willing to kind of share that again? There's a lot of opportunities to kind of explore and kind of increase, intimacy and like sexual connection for couples when we kind of figure out what's making that more appealing.
In your opinion, Sarah, when would, or does it ever, is there ever a problem or an issue? Like when would porn get in the way, I guess?
Mm-hmm.
Or when does it, is there a line that would be crossed as far as it being problematic in some way? Whether, I guess I'm going to leave that question open.
Sure. I mean, and it's a great question and a difficult one because there's no, if you watch porn once a week, that's good. If it's 10 times a week, that's a problem. Like if you watch it every day, like there's no clear cut line. Really what I do when I'm working with people is, how do you feel about your porn use? Like, does it feel too much for you? Are you dissatisfied? Do you want to be having more partnered sexual activity and porn is a distractor? Are we talking about compulsive pornography use where it's interfering with your well-being, your relationships, your ability to get to work on time? Then that we start talking about maybe some concerning behaviors that we need to talk about. the thing that gets a little tricky when we're talking about partners is one person might think that my porn use is completely fine. Like, I'm just using it here and there. It's just for fun. It's just entertainment. Like,
Mm-hmm.
anytime you're interested, I'm still happy to like connect with you.
Mm-hmm.
But the other partner might feel, well, I don't like it. Maybe I have moral objections to it. Maybe it makes me feel insecure. Maybe it makes me feel disconnected from you. Maybe it makes me question like what sex you want and whether I can provide that. Like, those are where some messy situations come from, um, where there's not necessarily a clear cut answer. Like, you both have your perspectives,
Mm-hmm.
and if they're different, we have to find some way to navigate this as a couple. So a really great question, but a really challenging one that I think is really case by case and client by client.
Absolutely. And I didn't mean to put you on the spot, but I
No,
always
no.
like having this conversation as far as, what people's thoughts are. And because a lot of the folks that I work with also have that. And I'm gathering too, just from my clinical observation, that when we talk about men and sexuality, or bring up masturbation or pornography or sexual imagery, that there's stigma around that and shame, again, depending on that person's upbringing, spiritual, religious beliefs, and
Mhm.
culture. Like that all, I think has a role, or plays into one's experience, or how one feels about masturbation or porn, and that goes for their partners, right? As you
Mhm.
mentioned, how that person feels about it, and what does that all mean. And so yes, it can be a very complex and deep conversation to have, for sure, and should be certainly individualistic.
Yeah, yeah. Yeah.
Mm-hmm. Mm-hmm. Well, thank you for diving into that territory. Appreciate you.
Yeah. More questions and answers there perhaps, but
Right.
yeah.
No, it's great. Again, it's just even having these conversations to share with folks, as far as like, again, there is no one way to have sex. There is no one way to
Mhm.
experience sexuality. I think it's really important, because it doesn't make people feel siloed or isolated, or um, quote unquote not normal, when we're not being matched up to these very unrealistic expectations that are being presented
Mhm.
to us. So
Exactly.
yeah. And so, how do
Mhm.
I initiate this conversation, and feel safe doing it? Any
Yeah.
tips for that?
Well, my first reaction is, I mean, let's just acknowledge that yes, these conversations aren't easy to have, right? And that's not a reason to not have them. It's just a reality. They are hard. It does require vulnerability. We are opening up about something personal about ourselves, and without knowing how that other person is going to respond. You just talked about kind of like a potential new partner. It sounded like that was the language. And so, when I'm working with clients who are dating and they're kind of figuring out how do I bridge these issues with a new partner, I mean, I think there's something to be said for, get to know someone a little bit, right? If you're talking about something that's a little bit more personal, it doesn't have to be the first thing that comes out in, date one. Like, you can take time to figure out, is this someone who feels comfortable and safe? And how do I kind of let them in just a little bit into my experience? If it's like a longer term partner, and that's when I see like a lot of couples in my practice, there's changes that happen over the course of relationship, and it can be really hard to switch the conversation after we're used to sex looking like this for however long, sometimes decades, and then it all of a sudden looks quite different. Being open and honest, and just kind of starting to say, you know what, there's just some things that I want to talk about. Some things feel different. Acknowledging this is kind of hard to talk about. Like, there's no clear cut, easy, how to. But I think acknowledging that it's hard, taking the risk, almost in all cases, from my experience, is the partner wants to know. Like, there's no good from like hiding that, like, oh, it's not so bad, or like, no, I'm fine. We can always kind of get a sense that like our partner's got something on their mind. And I think the more that we just kind of take the risk and open up about that experience, the better. And I think a helpful way of entering some of these topics, especially, I'm going to kind of shift again to my wheelhouse is a bit more like the longer term relationships, is you know to just kind of say, what are the norms out there? Like, what did you learn about sex as a kid, or like as a teenager, or like what do you think about like stereotypes about men's sexual desire or sexuality? What do we think about stereotypes about women's sexual desire or sexuality? Are there any ways that that fits for you, and are there ways that maybe it doesn't? So just something that kind of acknowledges that there are these norms out there, and like, can we talk about where we fit into that mold, and the where places that we don't? Another of my favorite questions, and I think most sex therapists would probably agree, is asking couples to like remember their most positive sexual encounter, right? Like, tell me about one of the best times you had sex and what was going on. And we can kind of explore the other parts that often are not just the penetration, right? It was like we had this really special moment together. I remember we were like on vacation, or we carved out this time to be together. We spent so much time making out. I remember just kind of lying in bed naked for hours, like, and remembering that sex can be so much more, and sexuality can be expressed in so many more ways than just this, like, penetration, or even things that we call
Right.
foreplay. Like, it can include all of those things, and I think that also kind of helps people kind of be able to focus on all the other things they like and that feels good, and just kind of have a different conversation.
Right. And it sounds even just like deepening their experiences of eroticism, pleasure,
Mm,
satisfaction, and emotional connection.
yeah.
And that I know even through my brief research on, masculinity and men and sex, that the emotional connection is really important, to have that
Mm,
trust. And even just for issues like performance worry, or having performance anxiety, and how that impacts erectile function. Um,
mhm.
those experiences are quite common and also normal to have, especially if for you as an individual, it's important to find that connection and that trust, and to show to participate in that, in a vulnerable connection like that. And
Mhm.
so again, I think just normalizing things and having this be the message would really maybe put us out of a job. Right? Like, no one would need us then.
Here's
So
hoping.
right, exactly, and creating just a more sex positive and a sex positive world. I wanted to
Mhm.
share, I know, off the air, we were talking about some, for a couple ships, long term, short term, and there are all sorts of different, I guess, editions or card games. But this one that I find like that's fun, it's called Skin Deep, or The Skin Deep. And if you go on their website, they have all sorts of like, um, I guess, topics, but it kind of goes through some questions like, um, and let's say one of them are you concerned that my body will change over time? There's all sorts of like, in the time we have shared together, when have you felt resentment towards me, and why? I mean, they're like they're deep questions. And
Mhm.
it's also just yeah, it just opens up the conversation in like more of a playful way and more of a safe way, and it can be a card game. So if that's what you're into, you can check it out as far as initiating some icebreaker conversations, and getting to know each other as human beings. And people that
Awesome.
change over time. So I just wanted to share
Yes.
that for folks.
Yeah.
Um, well, awesome. Well, Sarah, thank you so much again for sharing all that beautiful wisdom and such great
Oh,
advice. I just love having these conversations. I've said this probably several times throughout our time together, but I think these are important conversations to have, and especially talking about men and sex, because it's
mhm.
not a conversation that's easily or done in a frequency that we would probably hope for. So I'm so glad and very thankful for your book, The Not Always in the Mood. I'm thankful for the research that you've done. So much gratitude for what you're doing for your clients and those who you're impacting by your work. So thank you.
Oh, that's awesome. Thank you so much for having me and for your kind words. I've enjoyed talking with you.
Yes. And Sarah, where can listeners, if they wanted to connect with you or follow you on social media, where can they find you and connect with you?
Yeah, so my website is www.sarahhuntermurray.com. I'm on Twitter as Sex Doctor Sarah, and I have a blog for Psychology Today called Myths of Desire. So I think that's just Googleable.
Oh, that's awesome. And we'll make sure to link that in the show notes for everyone so it's easily accessible.
Oh,
And
perfect.
is there anything new that you're working on in life, in your career, any other research adventures or?
Right now, I'm just kind of focusing on the clinical stuff. The demand is high right now, and so that's kind
Mhm.
of taking up a lot of my time and energy. But my research focuses a lot on like cisgender men in heterosexual relationships. And I have just been really looking for opportunities to kind of expand to see where there may be differences or similarities or overlap when we talk about, queer and, bisexual, trans men. Like, I just am so curious about like where these things overlap and maybe diverge to be able to kind of talk to a more diverse population. So
Oh, that's
fingers
awesome.
crossed.
Yes. Ooh. Oh, definitely. I'm so excited and look forward to reading your research and hearing more about your work in the future. Again, Sarah, thank you so much for being on the show. And for all our listeners and viewers out there, thank you so much for watching and listening. As always, in loving wellness for your pelvis, this is Dr. Susie G.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear feedback. Thanks again.